The following program contains mature subject matter. Viewer discretion is advised.
You treat healthcare professionals who are addicts because you yourself have been through this.
I have. Yeah, I got addicted to opiates 30 years ago. I was a young cardiologist, and I had no idea what to do. I just felt tremendous shame. And so I kept trying to get off on my own until I was finally confronted by a colleague.
Looking at that decision, you said, whoa, if I come forward, I'm going to lose everything. All those years I spent in pre-med medical school residency, my specialty, my practice, my patients, my family, all that, boom, because, you know, we do have to discipline healthcare professionals that get into problems with drugs. So that was going through your mind. I understand how difficult that must have been.
Yeah, and I kept thinking I could do it on my own. I should be able to do this on my own.
Yeah.
You know, and then I just couldn't. And
so how do you now operate? 3,000 patients you've worked with. Talk to us about a healthcare provider and the unique situation and the way you're able to help them.
So I think the first thing is they need to be identified. You know, somebody needs to let somebody know to get them help. And there needs to be programs where they can actually get help. If there's just punitive approach, then they go into hiding.
When I was reading the stats on this, I was actually shocked because in 2009, less than 300 drugs were reported stolen or missing from federal hospitals. By 2015, that number had grown to almost 3,000. So that's a 10 times increase over 6 years.
Right.
So I think we can't really understate how much this is growing and what a big issue this is becoming. So more and more programs like this, I mean, to set that model.
10% of healthcare professionals, it looks like through studies, will have an addiction problem in their life.
Wow.
That's a lot.
The right way to approach it is that it's not punitive, that you come forward and say, I have a problem, I will voluntarily stop practicing, surrender my license, get my life back together, with the caveat that if I show that I've rehabilitated myself, I get the license.
And hopefully
I believe there are monitoring programs as well, right? Which have been incredibly successful.
Essential. Yeah, that's the way to get people back to work, is really in-depth, careful monitoring. So these programs that do early identification also have to do the back end after they get treatment. They have to do long-term, at least like 5 years in most cases.
And because this is state by state, we're going to have some resources on our website, because if you're a healthcare provider, maybe you know another healthcare provider, or you yourself want to reach out. I would so much rather someone who is addicted to these awful medications when they're abused seek help rather than potentially harm yourself or others first. I appreciate all of you for not only opening up, but sharing what is becoming an ever bigger problem.